my name is Jennifer Rekrut. I'm a Family Nurse Practitioner for Reliant Medical Group in the Same-Day Services Department, and you'll typically find me at the Auburn ReadyMED. And today I'm here to talk to you about influenza. Influenza, commonly known as the flu, is a virus, and it is typically caused by the influenza A and B viruses and commonly occurs during the fall and winter months. The way we get the flu is when we come in contact with somebody that is infected and we are sharing their respiratory secretions through coughing or sneezing. When we come in contact with somebody who is infected, it typically takes about 2 to 4 days for us to show symptoms of the illness. We can shed the illness once we have the virus for up to 7 to 10 days. The longer we shed it, that usually occurs in people who are younger, those immunocompromised, or those who have chronic medical conditions. So what are the symptoms of the flu? The symptoms of the flu typically include sudden onset of fever, body aches, headaches, and extreme fatigue. And you also may have some respiratory symptoms including a dry cough, runny nose, and a sore throat. Nausea, vomiting, and diarrhea are not typical symptoms of the respiratory flu virus. However, 10 to 20% of children may have some vomiting or diarrhea. There are some high-risk groups that if they get the flu, they're more at risk for complications of the flu. And those include people over 65, children under the age of 2, those in nursing homes or assisted living, anyone with an immunocompromising condition, and anybody with chronic medical conditions like pulmonary disease, so for example asthma or COPD, cardiovascular disease, kidney problems, liver problems, diabetes, sickle cell, and those also who are pregnant and even up to 2 weeks postpartum are at increased risks for complications of the flu. So what are the complications from the flu? Most commonly, and what we see a lot of people for, are subsequent bacterial infections from the flu. For example, pneumonia, sinus infections, ear infections, and also there are more serious complications that are possible when you have the flu, and those include anything like neurological symptoms, for example, meningitis, encephalopathy, Guillain-Barré syndrome, and also myocarditis, which is an inflammation in the chest, and pericarditis. Some people, especially the younger population, can get some muscle breakdown, which is called rhabdomyolysis. So what do we do about the flu? We basically treat it at home. It is self-limiting. It can last anywhere from 2 to 5 days. Around 2 to 5 days your symptoms should start to improve. However, some people will still feel really, really tired or just not well for a week, sometimes 10 days. We use acetaminophen or ibuprofen at home. We push a lot of fluids, make sure that you are staying hydrated and getting a lot of rest. There are 2 classes of antivirals that are available in the market for people who have the flu. The best time to start those antivirals are within 48 hours of symptoms. So the sooner you start the treatment, the better the outcome. Now, antivirals do not cure anything. They can shorten the duration of illness by about a day or so. If you are one without any chronic medical conditions and you come into the clinic or your doctor's office more than 48 hours after having symptoms of the flu, it is generally not recommended to start the antivirals. However, some studies have shown that if you do have chronic medical conditions and you present after 48 hours of symptoms, that there may be some benefit to starting antivirals. Now, antivirals may have some side effects. The most common will include nausea, vomiting, diarrhea, and sometimes bronchospasm. So basically, you want to stay really, really hydrated and get lots of rest. Also, if you were to develop bacterial infections, sometimes the way you know that something may be brewing is if you feel like you're getting better and then the fever returns, or you're experiencing a lot of ear pain or a worsening cough or some chest discomfort, then you should definitely be seen, as this may need some antibiotics for possible bacterial infection as a result of having the flu. So how do we avoid this in general? The #1 recommendation from the Center of Disease Control is to get your flu shot. The flu shot is widely available, ages 6 months and over. And there are some misconceptions that the flu shot can make you sick. The flu shot is an inactivated virus, so it does not give you the flu, and it does take about 2 weeks to become fully effective. So usually what happens is you come into contact with somebody that may be sick right before or while you were getting the flu vaccine, and then you develop symptoms of a viral illness that mimics the flu or makes you feel like you could have gotten sick from the vaccine. So definitely get your flu shots. Hand washing is really important. If it's at all possible, you also want to try to avoid anybody who is sick. You also want to rest, eat well, stay hydrated, so should you get flu-like symptoms, you're more well equipped to fight the illness. And most importantly, if you do get the flu, you want to stay home for 24 hours after you are fever-free, or stay home until you have no fever for about 24 hours, and that is without acetaminophen or ibuprofen or medications that can mask a fever. So this fall or winter, if you find yourself at home with flu-like symptoms and you feel like you would need some medical care or that your symptoms are disconcerting, we'd be more than happy to help you and take a look. So hope everyone has a safe and happy winter, and take care.